COVID was challenging for everybody. I know a lot of times you saw it popularized on the news with what was going on in New York and in the hospitals, but not much light was given as to what was happening to the long-term care facilities and the challenges we face. I guess you could say we're kind of overlooked as far as the severity of the impact. And we were faced with a lot of the same things with the shortage of PPE, the staffing challenges. We were also risking our lives from exposure with the patients as well as the staff. One time I know when we had the outbreak and I personally called every family member to say, hey, so such and such tested positive. That's just taxing and distressing because you feel for them on the other end as well, but then you also, because COVID is new for all of us, and then worrying about, if they're gonna think you caused it, that kind of thing, and knowing that you have no control over necessarily transmission or who gets it, who doesn't get it, or when they test positive and when they don't test positive, or when they were exposed and when they weren't exposed. Your only due diligence is to make sure they recover quickly and recover well. I think most nurses and most healthcare workers, nurses and CNAs and even physicians have some form of PTSD from the impact of what we dealt with COVID that people do not see and people don't realize.